Hi, Frank. Thanks, Shreya.
Hey everyone, we're gonna wait just a moment for folks to be able to file into the room. Oh, that does work like that. Haha. Sitting here learning how to like manage one of these without dual screen. We have a nice chunk of folks today and a really popular topic, so we will get kicked off pretty quickly here, but we still have quite a few folks just streaming into the room, so we're just gonna wait a moment. Appreciate everyone being here on time.
Hi, Thaddeus.
Oh, hi, Marie. How are you?
I'm good. How are you doing? It's been a long time.
It's been a minute. Yeah. How's summer out there on the East Coast?
Oh, it's very, very hot and muggy.
Oh,
Oh,
okay.
yeah.
I'll send some tropical breezes your way.
Oh, good. Thank you.
Please, yeah, please do. It is less than comfortable in the DC area, and it has
Oh
been
no.
gross for quite some time.
Oh, Marie, when was the last time I saw you? Was it pre-COVID? Must have been, right?
I feel like it. It's been a
Yeah.
while.
Wow.
And
Wow.
I feel like I'm standing in for your old friend Nira, who was here. She was always be so excited to see you.
Oh yeah. How
Yeah.
is she still working on houselessness in the health department or
She's not at the health department. She's at the Department of Homeless Services now. So she
oh
changed city agencies, but she's
oh
doing well.
wow.
Yeah,
Oh good. Well, if you see her, please tell her I said hi.
I will. Thanks.
Yeah.
That's a name I haven't heard in a while.
Yeah, I
Yeah.
miss her. She left quite a great legacy.
Well, I think we've the number has slowly kind of leveled off, so I'm glad to happy to get us kicked off. I'm really excited, everyone, for you attending today's Be Informed session entitled "Data to Action: Transforming Insights into Action." Credit where credit is due. This was actually Thaddeus's idea. He, at a national advisory committee meeting of HBU, mentioned as we were discussing different ways to really highlight data and ways it can be used. He mentioned an idea of really using a thing to kind of walk through the process of turning data into action. So of course, when he says a good idea, we then have to tap him to run that good idea. So thank you, Thaddeus. And then we are also joined by Marie Bresnahan and Meg Chappell, who are joining us from their work at Hep3 NYC. And I'm really excited to have them join us because I saw them using the data that they turned into something. They had data that they turned into something that they were trying to create action on, and it like moved me in the room earlier this year. So when this idea came together, I was like, oh, let's get everyone together and have a really really good one. Um, for those of you who may not be familiar with the Be Informed series, it is an Echo style format. So we do this every other month, and it starts with a didactic speaker who really deep dives into something, and then we have a case study who kind of goes over and shows an example in action, and then we really leave the rest of the time until about a quarter till to do Q&A. We try to have these go 45 minutes, but if it's a robust conversation, we'll keep it going until the 4 o'clock Eastern. But in general, just as we're going through, because this is a webinar, you will be, I gotta rearrange these slides next time. You will be on mute, but feel free to please introduce yourself in the chat, and also just any questions that you have as this progresses, please just drop them into the chat as well. We will have time for Q&A, but there will also be potentially opportunities to go and answer your questions as we go through the process. We will be recording the session, and we usually put those on our Hep B United website under capacity building. And if we have questions that we aren't able to get answered today, it's been our process to go back and try to find those answers and then let you all know what those answers are um, after the fact when we can find them. Um, Again, if you are new to the Be Informed sessions, this is a newer capacity building program run by Hep B United, which is a coalition of coalitions. We are funded by a CDC cooperative agreement, and our goal is to really just like right here what it says under the mission. We're looking to tackle hepatitis B and all the pieces that kind of surround that. And one of the things that folks asked for was these sort of capacity building webinars. So really appreciate your ability to join us. This is the schedule. We've spent these first 5 minutes with welcome and housekeeping and a description of series. That's what you just lived through. And then from here, I will happily turn it over to Thaddeus from Hep Free Hawaii. And let me stop my sharing. And then Thaddeus, would you like to share your screen or have us, or would you like to share your screen? You should be able to.
Yeah, sure. Just let me know if you folks can see the full screen.
We can. It looks great. Okay.
Awesome.
Well then I am beyond excited to pass it over to just the data awesome sauce himself, Thaddeus Pham.
Awesome. Thank you, Frank, and I'm glad I could be awesome sauce today. So thanks everyone. If you haven't met me before, my name is Thaddeus Pham, he, him. I'm the viral hepatitis prevention coordinator with the Hawaii Department of Health and also the co-director of our community coalition, Hep Free Hawaii. For those of you who know me for a long time, you also know that I'm known as the Queen of Hepatitis in Hawaii, and I respond to all honorifics, including Your Majesty and Your Highness. But today, I'll be putting on my data queen hat. I'm going to talk to you about translating Hep B data, right? So we talk a lot about like linguistic translation for Hep B education, but how do we translate data? And I'm going to just, caveat this a little bit and say the subtitle is What We Did in Hawaii, because maybe it might work for you, maybe it might not, but maybe it might make you think about opportunities in your own jurisdiction, in your own organization. So let's see how we translated things in Hawaii. But first, let's take a breath. Look at this beautiful shot from Kauai. It's really beautiful right now. And I'm gonna have us, think about as we move forward, what the opportunities of data are, and to remind us what one of my mentors once told me, and I'm sure many of you have heard me say, but don't get mad, get data, right? So, and maybe in this day and age, we can also say get mad and get data, but really the data opportunity is there, even if you don't feel like you're a data person, which I am not, right? But I think the value has been shown, and over time, I've been really leaning into what data opportunities come up. This is Hawaii, to give you a little bit of an idea, a little bit of a geographical look at that picture. So we are those little chain of islands in the middle of a vast ocean. And so I bring this up to get, again, just to note that the cultural and geographical context of Hawaii is very specific. So take what you will from this, but also I'm going to shout out our rural folks who are probably on here, our small town folks, our little coalitions who are out here listening in. This is a lot for you because like you, we're mostly rural. We're separated by ocean for our rural communities, and we don't have a lot of resources all the way out here. So perhaps this can help you to figure out maybe what's available, even in low resource, smaller coalitions. So shout out to you all. So the question that I'm going to start you folks thinking with, right? We already know don't get mad, get data. And so the next question that makes sense is what can you do with what you have, right? So this isn't really a presentation on finding new things, but maybe seeing what's already around you. And so I'm going to start with an example of what we did in Hawaii. I'll give you some tips and things to consider, and then I'll show you how we translated that into data, right? So you could see here, if you look at the very bottom, that we don't have a lot of great data surveillance-wise, right? In the public health surveillance sphere, we actually don't have a lot to report because we didn't have capacity for data and data collection in the public health realm. But we knew there was opportunity, right? We knew there are people around us who are really smart epidemiologists. They might actually be in our different sections of the health department. They might be outside of the health department, but we have folks in place, right? So we identified some champions who had some data savvy. And then we looked online to see what was publicly available. And for us, after you did a quick look, we found CDC Wonder, which is publicly available data that has mortality data, which all of you can access, right? And I'm not going to go into the nitty-gritty, but I'm going to share with you what we learned thanks to the magic of our epidemiologists, the true data queens. So using this publicly available data source, we were able to find and analyze and show that this upper line, the orange line, or if you can't see color, it's the upper line, is Hawaii. The lower line is the US. If you can see color, it's blue. And you can note that for about over this 20-year period, Hawaii had higher rates of hepatitis B associated mortality than the entire US, right? So already we can see that this data is striking for our little chain of islands. And when we look a little bit closer, when we look just in the state, you can see the upper line is green, and the lower line is orange, again, if you can see color. And the lower line is all residents in Hawaii. The upper line is Asian Pacific Island residents in Hawaii. And again, over those same 20 years, Asian Pacific Islander residents in Hawaii had higher rates of hepatitis B associated mortality. So the inequities and the disparities are there. So I show this to you not to really unpack this data, but to really consider now we have this data, right? We got publicly available data. We turned the source into data that has some meaning, but what are we going to do with this, right? So this is hopefully the part that might be a little bit more helpful, and this is the tips and the tricks part. So how do we translate what we found into meaning for our local community? So I'm gonna, first of all, again, bring us back to this beautiful setting, have us consider what this means, and really remind us and ask us this really big question: what is truth, right? And I bring this up because I work a lot with epidemiologists who love data, right? And sometimes it's, for an epidemiologist, truth to them is telling you the size and position of every single blade of grass in this picture, right? But for community, that is not useful truth, right? We do not need to know the measurement of every single blade of grass. What we need to know is, what is the field, how's the field doing, right? Is it going to continue to grow? What is the timeline for flowers, whatever, right? So just to remember that as data people, sometimes they really get interested in giving you everything. But remember, as community, the question to ask is, what does community want to know, and try to answer that question, right? And this is a big conversation I have a lot with our EPIs. So just keep this in mind as you're trying to translate your data. Maybe start with the question, what does the community want to know, and go from there, rather than just giving data, right? We don't need to know every single blade of grass. So here are kind of four kind of ideas that will hopefully help you. So the first thing I think is to align efforts, and that goes back to the questions, right? So what is the answer you're trying to provide for community? And these are places you can look, right? So are you going to try to align your data with messages, right? For example, ours is higher mortality among Asian Pacific Islander residents in Hawaii, right? So how does that align with HEP United messages or efforts around supporting API communities? How does it align with CDC messaging? Does this align with your elimination strategies, right? Can this kind of move things forward? So consider the WHO plans, the HHS plans, or your own local kind of strategies, right? So using that data to kind of push forward your elimination efforts. And then maybe you are a policy wonk and you are pushing bills or changing laws or asking for money, right, with grants. So how does the data answer the questions that help move this forward, right? So align the data with your efforts, right? Don't tell us every single blade of grass. Tell us how the field is doing, and how we might kind of make it thrive a little bit better, right? So that's the first one. The next one is really consider access at all levels. Sometimes in the health department especially, we love to give you an 80-page report that no one reads, right? So what are different channels of communication, and really try to reach out and use every single one if you can, right? If you have that capacity. So these are kind of three ideas around access at all levels that would be their own presentations in their own right. So one is just use plain language for many reasons. One, it's simpler, right? Two, you're going to get more people to understand. And three, actually back to translating into other languages, it's actually less costly to translate, and it's easier to translate, right? It's easier to translate liver disease than to translate cirrhosis, right? So consider simplified words and plain language if you're trying to increase access at all levels. Talk story is what we call it in Hawaii. This is really the idea that, we tend to learn experientially, right? So when you have a conversation, you will probably absorb it better than if you have to read it on a pamphlet. And actually, this comes from our community folks who throw away our pamphlets, even if we translate them, because they're like, this is literally not how we learn about health in our communities. So consider talk story modalities, comic books like Charles B. Wang, videos on YouTube, radio spots where people are having conversations. Those modalities are really helpful for people to understand and absorb data in a meaningful way. And finally, as you probably see from this presentation already, lots of pictures, less words, more pictures. And we hear this a lot from our folks, right? So again, making an infographic is great, but don't make your infographic too wordy, right? What is the audience asking for? And try to remember accessibility for visual, right? So I didn't do a great job on those graphs, but if you have to use different graphs, use different kind of textures or something like that, use contrasting colors for those who have different visual acuity. All right, so we have Align, we have Access, and now we have Amplify. So this is where we get into those social media or those other media channels, right? So I know that we love social media nowadays and we should totally amplify that way, but acknowledging that also many community folks who use social media also still listen to radio a lot, also still listen to podcasts. Newspapers are still around, so especially in language newspapers. So really consider all the channels, right? Social media is one part, but some I think we lean really heavy on that, and then we leave some communities out of the discussion. So consider all the ways that you can amplify that, right? Something that's helpful if you want something short on social media is to still create what we call evergreen materials, right? So have all your nitty-gritty stuff on a website and link to it, right? So you could still have short, punchy messaging, but you always have an enduring resource for folks. So that's been really helpful too. So remember, we've already talked about Align, Access, Amplify, and the last one is Activate, right? So this is the people part of it that's so important. This is our coalition meeting last year. There's a lot of great folks on here. But this is where you're going to take those channels, you're going to take those products in plain language that are talk story and that are aligning with your messaging, and you're going to bring it to people and have them send that message out to, or you're going to have them use it for action, right? So these are 4 ways that we consider how to translate data into action. And I'm going to give you an example right now. So this is what we did in Hawaii using that Hep B mortality data. So Align, right? So first we're like, let's see how this aligns with our statewide strategy, which is called Hep Free 2030. Of course, it aligns with our data strategy, which is only 1/5 of the entire wheel of priorities. But actually what we did was, you know what, data actually falls into all of these priority areas. So all of the groups working on our elimination strategy should include this data and be helping with amplifying the Hep B mortality data. Then we wanted to increase access, right? So we did this by several ways. You can QR code this if you want at this moment, or you could look at the slides later. But we created a report, right? But this is our enduring material I mentioned, right? So even if this isn't the main thing that's going out, this is kind of the one that you're going to refer back to, right? That has all the nitty-gritty stuff. But we're going to make it easier for people to read. So we translated that into a 1-pager with 3 messages, right? You can see that right in the middle there. What we're telling people is we have higher rates of hepatitis B deaths in Hawaii compared to the US, and it really disparately affects male residents and Asian Pacific Islander residents. So 3 simple messages that folks can echo and talk about and feel like they know, right? And if they need more info, they're going to click on that longer report. We also, for our providers and researcher folks, we publish this in our local peer-reviewed journal article to give it additional cred, right? And create an additional evergreen resource, right? You can always refer back to this if you want more kind of the nitty-gritty. We also posted this on our DOH website, our Department of Health website with infographics, and we also posted on our Hep Free Hawaii website. Then now that it's out there, right, in these products, we amplified it. So we created a press release through the health department, which gave it kind of an official blessing in a sense. And this was picked up by a lot of our media channels, right? So both neighbor island, rural. It ended up on our Hawaii Public Radio, our NPR affiliate, and I didn't even know it was going to be on there. So folks came in to tell me that they heard it on the radio coming into work. So this kind of got a lot of amplification through that initial press release, right? And we're able to respond and answer questions from media partners. Here's a social media bit, right? So the Hep Free Hawaii created this version of that infographic, and the Department of Health mirrored that and amplified that and created social media products that were saying the same messages, right? So through social media, we're able to amplify the messages as well. And finally, similar to this, that's Fen Fang, one of our amazing epidemiologists. We presented this, you might have seen some of this data already for CDC, for NASDAQ, for Hep United. So really that talk story moment, having someone tell you about the data is really powerful. So the last piece is really how do we activate our folks, right? So we have these products, we're amplifying through channels. So something we do at the beginning of every single monthly meeting for Hep Free Hawaii Coalition is we restate this data. And I'll show you what this looks like, the 3 slides that we use. So we remind our coalition members, you know what, we are here because we can save lives, because the data shows that people are dying, have higher death rates due to hepatitis B in Hawaii, right? Especially our Asian Pacific Islander residents. So how can you help us save lives? So we activate our coalition members by giving them a message and giving them an action that they can help us save lives based on this data, right? We were also able to use this very simple data for our policymakers. So this is our state legislature. Those are our 2 main health chairs. This is back in October 2023, to present this data to them at a legislative briefing and be like, Hep elimination is important in Hawaii. We're saving lives. People are dying in Hawaii because of hepatitis B. So please give us money. So we're currently working on that as well. And they heard it, right? It was a simple message. They didn't have to think too hard, and they were able to absorb that information quickly. So I'm going to end now and then turn it over to my colleagues, but really remind us the question that we started with is what can you do with what you have, and consider what we as a small state with not a lot of resources we're able to do with publicly available data and just amplify that. And I just put this all on a slide for you. So if this is helpful for you, this is what we did, right? We aligned, we increased access, we amplified, and then we activated. And if this is helpful, I hope you can use this. Otherwise, I'm sure there's going to be great wisdom from my co-panelists. So as we end, I'm just going to leave you with this beautiful field of brass, right? We're looking at the field. We're not looking at each individual blade. And if you have any thoughts or questions, please feel free to reach out to me. But I'll turn it back to Frank for our next panelist. Thanks, Frank.
Thank you, Thaddeus. That was great. And don't be surprised if you see different things at the next HPU Coalition call that may or may not be directly yoinked from your presentation just there. Thank you so much. I feel like that is a fantastic kickoff for us to then lead into our pair from New York City. So I am suddenly blanking on who's going first.
I'm going first, but Marie's going to share the script.
Okay. So we are joined by Meg Chappell from the Empire Liver Foundation and Marie Bresnahan from the New York City Department of Health and Mental Hygiene. And they are both part of the Hep Free NYC Coalition. And I will let Meg take it from here. Marie, we see your speaker slides.
Okay, let me just gonna ask about that. Let's see. How's
There
that?
we go. That's great. We see your full screen. Thank you so much.
Thank you.
Hi, everyone. Good afternoon. Thanks for having us today. My name is Meg Chappell, and I'm the program manager over at Empire Liver Foundation and the Hep Free NYC Advocacy Committee lead. So we're going to use our time today briefly to just share how we've put data into action here in New York City. The next slide. So Hep Free NYC is a capacity building network to prevent, manage, and treat viral hepatitis in New York City. And this is an umbrella network in which targeted coalitions and committees fall under. One of those is the New York City Hepatitis B Coalition, which was founded in 2009. We also have a hepatitis C task force, and we have the Advocacy Committee, which I am the lead of. And all of these coalitions and committees are led by our community partners. Next slide. So the Advocacy Committee really focuses on supporting the Viral Hepatitis Initiative, and our goals of this committee are to educate city council members on the impact of Viral Hepatitis Initiative, share information with community members of advocacy and legislative issues, and to provide information to the HEP Free NYC community regarding local, state, and federal legislative issues. Next slide. All of the coalitions are community-based organizations, and we partner very closely with the New York City Health Department to provide us with data that we put into action to support the work that we do. And primarily we use it, I think kind of Thaddeus meant to get money and to secure funding. And so I'm going to pass it to Marie, who's going to share a little bit about the data that we use, and then I'll take it back at the end to show a recent example of how we've done that.
Great. Thanks so much, Meg. So I just wanted to give a quick overview of Hep B in New York City and describe some of the ways that we use data. We put data to action, as Thaddeus spoke about as well. So in 2022, there were 5,534 newly reported cases of chronic Hep B, which is a rate of 65.4 per 100,000 people in New York City. The increase in newly reported cases from 2020 to 21 was most likely due to fewer people accessing health services during COVID, rather than an overall major increase. And the surveillance data that we're able to collect provides us a really good snapshot of Hep B and allows us to look at some aspects of who is infected with Hep B. So you can see in New York City, similar to Hawaii, there are more men than women. Almost 60% of men infected with Hep B. Almost 40% of them are from Brooklyn, and almost 30% are from Queens. And the majority of people with Hep B in New York City are between the ages of 30 and 49. So this kind of data is displayed every year in our annual report, and this helps us hopefully focus resources where they really need to be focused, like using more resources in Brooklyn and Queens, and making sure our community members are aware to target men and that mid-range age group who has the most hepatitis B in New York City. Another tool that we use to look at hepatitis B are maps. We develop heat maps, and a couple of my colleagues are on this call who do all the work on this and will be available to answer questions if need be. But heat maps are generated to display data by geographic region. So traditionally, New York City has done these maps by neighborhood tabulation area, also called NTA. NTAs were developed by the New York City Department of Planning, and they are used by many city agencies to look at data that is grouped by neighborhood. And in this map, I'm going to point out the Chinatowns, which number one, there's a large Chinatown in Sunset Park in Brooklyn. Number two, there's also a large Chinatown in Flushing, Queens. And then on this map, number 6, you see Chinatown in Manhattan, because we know, similar to what Thaddeus said, the largest population in New York City with hepatitis B is the Asian Pacific Islander population. So these maps we had done, I think, for many years. We've done them in the past by census tract. We've been doing them more recently by these neighborhood tabulation areas. But the community came to us and asked us if we could look at maps a bit differently. In fact, they asked us to really create an advocacy tool for them and asked us if we could create maps by city council districts. So in New York City, we have city council districts. Every part of New York City is grouped into a city council district and represented by city council members. These city council members work with the mayor to oversee basically everything that happens in New York, including a lot of funding. So this map, similar to the last one, but a little bit different. You can see on this map that District 38, that top, the largest group there, is the same as in the other map. That is Sunset Park, which is in Brooklyn, which is Brooklyn's Chinatown. District 20 is Flushing and other parts of Queens, which includes a significant portion of the Chinatown in Queens. And then number 3 on this map, District 1, that is Lower Manhattan, where the Chinatown in Lower Manhattan is. So the neighborhoods and the ranking moved around a little bit from map to map. although they're pretty similar, the 3 Chinatowns are in the top 6 via neighborhood tabulation area and in the top 3 by city council district. So not a big change, but what we have found is that these have been an effective tool for our community members to use when they're advocating for Hep B funds, when they're talking to their city council members. So, in summary, the community asked us to make maps differently. As I said, we have developed maps in previous years by census tract, by neighborhood tabulation areas, but data presented by city council district allows our community members to use these districts when they advocate with their city council members. And the city council has designated at this point about $2.24 million for community-based organizations to do hepatitis B and C work in New York City. And some of our partners have received additional funds because they use these maps, use this as an advocacy tool to ask their city council members for additional funding. I'm going to turn it back to Meg for this last slide.
So as you can see, this is a picture here of our recent example of putting data into action. So the Advocacy Committee hosted the New York City Council education briefing in collaboration with the New York City Health Department on viral hepatitis back in March. And we had great support from a lot of local city council members. You can see there's the tall person in the center is Councilman Eric Botcher. It's not always easy to get council members in the room with their busy schedules and their competing priorities. And so community members that were part of organizations, part of the Viral Hepatitis Initiative, sent heat maps that Marie shared to the city council member offices, inviting them to the briefing with the map to say, hey, look, these are the rates of Hep B happening in your community, in your neighborhood, under your constituents. We invite you to learn more about this. So they really targeted districts that had high rates of Hep B, and we were able to get a handful of city council members in the room because they saw the high rates and they realize that this is impacting constituents in my neighborhood. And so they kind of feel compelled that they need to listen to their constituents and prioritize the health of their constituents. And after the meeting, we had several city council members asking for the maps because they wanted to sort of, escalate it. And as Thaddeus mentioned, sometimes lengthy reports and lots of words and busy things kind of get passed over when in the hands of people that we really need to review these things. And I think having a map was really straightforward, really easy to digest, and really clearly showed the discrepancies in some of the neighborhoods. As we can kind of see, data speaks for itself and really serves as a critical piece for securing buy-in and from stakeholders, included elected officials. And in our case, these elected officials fund the viral hepatitis initiative, so we really need buy-in from them. So the maps really serve a great purpose for us. So I think that's it from our end.
Yeah, thank you so much, Meg. Our Meg and my email addresses are listed there, and we're available for questions as well. A couple of my colleagues who work in surveillance here at the Health Department, Holly Anger and Cynthia Ortigoza, who help make those maps, are available, I think, with us to answer questions as well.
Thank you very much. We've had one question. We'll dive into it in just a moment. For others, please do put in your questions. So I was fortunate enough to attend that event in New York with the city council folks, and it in fact was one of the heat maps that caught my eye that led me to reach back out to Marie and Meg. But something else that was very interesting about their heat map that really grabbed me as a hepatitis advocate, someone who formerly worked primarily on Hep C and now primarily works on Hep B, is they had a heat map of B and C for the area, and it made me realize how much higher the prevalence of B is in New York City than Hep C, which is not necessarily always the case. We often hear about Hep C being kind of a bigger problem in urban areas or among certain communities. And so to see this like great data really just showing how big of an issue Hep B was in the city and where compared to Hep C, it caused me, that data sent me into some action to be like, oh, there's like 10% of the US prevalence in New York City alone. What more can we be doing? So that's one piece of it. And then just as we at HBU look at different data into action, whether it's advocacy or capacity building, those two maps would very much get used differently for us as well. So when we're looking at where to send our like capacity building dollars or other kind of grant making, having an understanding of what organizations are working in what communities that are most impacted helps us make that decision. And then when we're advocating, though, sometimes we definitely have to slice kind of the data differently, look at it in a more statewide way, or even something more hyper local to really drive home, or in some cases even more hyper local, instead of talking about a congressional district, doing something along a specific community group. So it's kind of like having all these blades of grass and then trying to find like, oh, do you need someone who wants like a little square of like Bermuda turf to bring over? Or are you looking for someone who wants to like go mow the whole day? I just kind of have you have this field and you can play with it a couple different ways. So the question we've gotten so far is has New York, and actually I think this may potentially impact Hawaii as well, but have either of you seen any data thus far about the impact of new asylee seekers entering your jurisdiction?
I wonder if Holly might be able to respond to that.
Give me one moment, Holly. You are allowed to talk now, Holly.
Okay, thank you. Hi, everyone. This is definitely a question that we have had in our brains. But it is hard for using our surveillance data to really drill down and to see this. We're still finalizing our 2020 data for Hep B. We do, I think I can say we might be seeing a slight increase, but it's hard to directly attribute that to the recent increase in asylees in the city. We are working with some partners to see if maybe we can look at different to partner with different ways to explore this in our data. Be looking at address where we're reported from and things like that. But because we're really limited in things like country of birth data and things like that in our surveillance data, because it's so dependent on laboratory reporting, it's really hard for us to drill down on this. I had a better answer. So.
What about, let's say instead of data, what about anecdotally? Do we feel like has there been a belief that we're seeing a shift in communities being served by health departments in urban settings? Potentially that.
Anecdotally, I can say that I've definitely come across folks that are being reported with shelter addresses, from migrant shelter addresses. Okay. But again, that is anecdotal. Like, I can't really speak to larger trends. So it's really hard for us to say to say with any certainty.
Understood. Yeah, and we've had other partners who have flagged for us that the clientele they are working with has shifted, especially in places like Texas and in like Philadelphia, seeing a higher increase of asylees. But again, I mean, data is a little bit behind, and so just hadn't had some of those numbers put in. I see a hand raised, but I can't tell from where. Moria, let me see if I can allow you to talk. Go for it. Moria, I'm sorry if I missed that name.
That's okay. Yes, my name is Moria Bernzala from Bronx Health Reach, and I work on COVID and flu vaccination. We have a small outreach team, but we're servicing many zip codes in the Bronx. And we've been seeing Hep B cases, which is why I'm on this call. One person actually passed away from Hep B, which was really sad. And I'm just trying to get a handle of what might be, because I looked at some of the literature and I'm not sure if it's appropriate for my audience, first of all. And secondly, they're mostly Muslims, so I'm not sure how the contraction is happening, so I guess I'm curious about that, if it's like medical equipment or what is the way. I don't know, I just was wondering if there's any insight about the Muslim population and Hep B.
Yeah, I think that's a complicated question, Mara. We have some colleagues here that work in that have a committee called the South Asian Hepatitis Initiative. And like we do work with hepatitis B and African immigrants. So maybe I could connect you with some of my colleagues who are more
Yeah, that
closely
would be
working with
really
that
helpful.
population.
Thank you.
That's about what I was going to say, Marie. So, Mariah, we at Happy United have multiple New York City and New York State partners, but often it is like a specific partner who will reach out and say, you know, we are wanting to go to this religious institution. And so we have like some who focus on the Muslim community, others who focus on the Hindi community. We've had folks do outreach within Sikh communities, so
Mhm.
it's it really kind of ends up being someone in that community who has a connection, and then you know, kind of builds that connection out, and we help provide technical assistance. When you mention like resources maybe not being like appropriate, do we mean like incorrect language, or just something that needs to be a little bit more culturally competent for people of Muslim faith?
Well, because first of all, they don't drink. So, you know, they may be thinking, well, why would I have a liver problem if I don't drink alcohol? Or, you know, I don't know. I don't know a lot about Hep B. So, but that's some of the things that might come up. And then also a lot of the pictures that it doesn't really look like anybody, you know, the population I'm working with.
Got it.
So when I was looking, and honestly, I've seen that across the board. I was looking at some other resources online from other organizations, and they just weren't appropriate. So even though the material was great and informative.
No, thank you for flagging that. That is something that Happy United has worked very hard to continually kind of stay up to date on being culturally competent for a variety of communities. And we also, within language, that's part of why the Happy United's resource repository, we flag that it has 30 non-English languages represented. But I think, I'm not sure we have done something specifically for people at risk for Hep B among the Muslim community. So that's something I'm going to take back for conversation within the foundation to help us build out some of those resources. And I see that Marie's sharing her screen with some stuff.
I couldn't resist sharing because we do have some resources on Hep Free NYC that are targeting diverse communities that I'd recommend.
I haven't seen these, so this is helpful. And I would say, yeah, I haven't seen these.
Okay, I put the link in the chat. So it's Hep Free NYC, and then look for the South Asian Initiative.
Okay.
It's a committee.
Okay, great. I'll check that. Thank you.
There's a question from Karen about Dr. So, I'm assuming this is Sam So, screening much of San Francisco's Chinatown 15 years ago. And if we've looked at some of those things, I actually think some of the pieces he instituted on that campaign have been like published on, but I was not around when that came out, but I do have colleagues who were, and that's actually a great one to go back to. And Dr. Stowe has been a longtime partner of HBF, so thank you for mentioning that, Karen, and we'll see if we can't re-highlight some of those success pieces as well.
Yeah, and then Frank, I just wanted to note, like, I agree with Karen. I think it was a word effective campaign for a particular type of message, right? I think it was like, was it the 1 out of 10 people who are Asian Americans have hepatitis B? Was it that campaign, I think, Karen? Well, regardless, I just wanted to note, like, if it is that campaign, I know it was really successful in raising general awareness, but I also know that some people had feedback that felt it was further stigmatizing. So just to acknowledge like the both and qualities of certain campaigns. And I appreciate Mariah bringing up that request, and Marie for sharing those resources. I'll just note for some of our folks, we work with a lot of the Pacific communities. Sometimes they ask that faces not be shown. So if it's helpful, sometimes we show hands of people or something like that, if so that they don't feel like someone is being targeted, or like there's concerns about stigma around that. So those are other opportunities that were helpful for at least our local folks.
And Sadha, I can't see the rest of your name. I'm sorry, it's cut off in the chat. I wanted to flag what you've written in the chat about specifically practices in Islam related to transmission. That is certainly heard. In fact, kind of where the cultural competency piece comes from is, I'll actually use a case from NHP, the Native Hawaiian Pacific Islander Learning Collaborative that Happy United hosted earlier this year. We were going through some of our resources, and it was flagged for us that it would be inappropriate to talk about sexual transmission of Hep B in a public setting among mixed families in those communities. And so, all of our information was correct and accurate and reflective of the community, but we had a piece in there that prevented our community workers from being able to use that resource. And so it's some of that, like just how do we present the information in a way, a design, and everything else that doesn't kind of break or go against something that might be important in that culture. And we tend to do this. We've done this by faith group. We've done this by racial and ethnic groups. We've done this by gender groups. We've done this by geographic location. So really, we are working hard to make tailored data, or work with you all to make tailored tailored resources for communities so that they may have something that is most effective for them. Oh, no. Yeah, exactly. We want to get that information out without offending or triggering anyone. Other questions or comments? Oh yeah, please go.
Frank, I just wanted, that was a great point that Sadhana had brought up. And we've seen that also locally, again, with our Pacifica peoples, where I think this is where that talk story element comes in, where sometimes on a piece of paper, it can be really kind of like triggering or inappropriate culturally, but in these kind of like conversational settings, that might be where folks feel comfortable with, with the appropriate, maybe sometimes gender alignment or cultural alignment. So I just want to amplify what you said and thanks Sadhana for that comment.
Yeah. I had one last little question and we can wrap up because we're right at the quarter after, but Meg, you're on the you're helping lead the advocacy committee. Advocacy materials look a little bit different than epi materials. What's the advocacy piece that you wish you had the data to put together? Like the one that you would love to build, but you don't yet have the data. Like what's that pie in the sky hope? And you are on mute, just
You just hear me. You can just hear me thinking.
yeah.
Oh, that's oh. I'm trying to think, and nothing is coming. Like I know there definitely is stuff, but I'm trying to think as I'm kind of quickly going through the materials. I don't know, Marie, if you have anything that's coming to mind. There definitely is, but I'm not.
Well, I would say we have an elimination plan, a New York City
Mm.
viral hepatitis elimination plan that includes B and C, and it's currently like an unfunded project. And, I think there would be some really interesting data to put together about what it would take to get to elimination in New York City, like what's truly needed. Like the plan spells out a lot of strategies, but there is some data I think that would be interesting to show policymakers and decision makers what it would take to make a real sea change on hepatitis B.
That's a really good one. There you go. Meg, she bailed you out there.
She totally did. Thanks, Marie.
That's a fantastic answer. I was gonna say, I really wish we had any sort of accurate care cascade for this country, but especially if we could break it down by insurance type or and long as well as among our normal demographic type. But I really do think that healthcare access and insurance access is such an important aspect of whether you can get your screening, your vaccine, or your treatment. And yet we are not able to necessarily keep those access issues from occurring, unfortunately. The very last thing I will note about data is for many folks, I'm sure, are aware that the last few years the White House has been working on a Hep C plan, and something that Hep B advocates have been waiting on. Really, everyone on that plan been waiting on is this report from the Congressional Budget Office saying like, hey, this idea is going to save X amount of money, save X amount of lives, and they came back recently to say, actually, we need a little bit more data. Like we can see that in closed systems like Medicaid, that yes, testing and treating Hep C is going to result in cost savings and save lives, but they flat out say like, we don't have enough to find out otherwise. And we know that in the Hep B space, that data is even more lacking. So I hear you, Maria. Really wish we were able to have some of that modeling, not even state and locally, but nationally to look at it. But even the big guys that have way more funding aren't getting there yet. So all right. There's a question about if the elimination plan is open to the public in New York City.
Yes, I'm going to put a link in the chat so that you could access a copy of that.
Great. And I will say anyone who's focusing on New York State, feel free to complain about the fact that they only have Hep C in their elimination plan right now. They've been very open to conversing about the inclusion of B down the road, but right now that it only has C, so we keep being like, hey, you forgot the letter before it. So feel free to keep pushing them as well. I'm sure Meg and Marie would be thankful for that also, because they're tackling both right now. All right. Any last words from our panelists? I feel like this is just such a great source of info for everyone. All right. Well, I want to say thank you to all of our 70+ attendees who came on, and to Thaddeus, Meg, and Marie. This is yeah, just so informative. We will have this recording on the website later this week, and we hope for September to have a CDC speaker with us to talk about the new case definitions for Hep B. We are still getting that finalized, but CDC has said that they want to try to bring on a subject matter expert for us to pepper with all the questions we can think of. So keep an eye out. That'll be happening in September. And otherwise, feel free to reach out to any of us on the screen, or to Hep B United if there are questions or other follow-ups you have. But otherwise, I'm happy to hang up and let folks get back to their very hot day across the country. So, thank you very much all, and hope you all have a good rest of your day.
Thank you. Bye.
Take care, everyone. Thank you.